Welcome to Deuk Spine Institute. I'm Dr. Ara Deuk-Majan, CEO and founder. It is July 25th, 2024, and we are going to have a full day of surgery today for you. We have 5 surgeries. 4 of them will be broadcasted, right?
Yes.
1 of them will not, because it'll be in a different room. Our patient is here from Hawaii, from the beautiful island of Maui. He has already had a sacroiliac joint rhizotomy done 2 days ago, and he's here for 2 discs in his neck that are herniated. We're going to try to fix them for him right now. We're doing number 4-5 and 5-6. You can see on the bottom corner of your screen he has an MRI, and he's having a lot of problems with the neck pain. Herniated discs cause neck pain. They're the number 1 reason people get neck pain, chronic neck pain. Herniated discs. Henry, you want to show our audience why do herniated discs cause neck pain?
Yes, sir.
Huh?
Yes, sir.
You can see from our video, AP, why discs cause neck pain. It has to do with inflammation. Shot. All right, lateral. So what I need to do is I need to place this needle in his disc through the front. Shot. All right, we're going to start with number 5-6. 2, 3, 4, 5, 6. Shot. Come on. Okay, good. Shot. Shot. AP. Let's get an AP. We're going to check the front back view to make sure we're right in the middle. 2, 3, 4, 5, 6. All right, we're off to the side. I want to reposition. Shot. Good. AP. I can feel the front of the disc now. Quick AP. Very good. That's really nice there, actually. Shot. So to do the surgery, I have to displace the trachea and esophagus. Let's get a quick AP. The lateral looks good. 2, 3, 4, 5, 6. So we're in the 5-6 disc. It's the bottom disc that we're going to start with. Perfect. Right in the middle. I love it. And we're going to get a discogram. Now the patient's asleep, so this is not an evocative discogram, it's a chromodiscogram. Basically checking to see if there's a tear, which there will be. Shot. There it is. You guys see the tear there? Jordan, one more. Show us the tear.
Yes, we do.
There it is. So that tear that we just showed you is the dye injected in the middle of the disc leaking out the back. And you can see the herniation. Shot. Show us the herniation there, Jordan. That's it. Right there is the herniation at 5-6. I'm going to inject some medicine under the skin. The herniation comes from the tear. The herniation is the nucleus pulposus, or material that is in the middle of the disc that is leaking out through the tear. Now, everybody thinks a herniation is one piece of disc that squeezes out. It's actually a collection of many pieces. That's what we've determined at Deuk Spine over the years of doing endoscopic surgery. The incision is 4 millimeters. Shot. Now I'm going to take the needle out and I'm going to bring the dilator down over the guide wire. We've done 1,000 of these surgeries at Deuk Spine in the last 18 years. This is endoscopic spine surgery. You're watching the future of all spine surgery right now. Not spine surgery for tumors necessarily, but for degenerative conditions like disc problems. All right, I'm just wiggling my little dilator down to the spine. And the tip of this dilator, AP, is actually blunt. It's pointy but blunt, like a pencil. It doesn't cut. All it does is spread. And what I'm spreading, it's perfect, right in the middle. You can see the spinous process. Show us the spinous process above and below. You can see the dye. Show us the spinous process. Can you guys see the arrow?
Yes, we do.
There and there. And if you draw a line between the two, that's right where the tip of the dilator is. That means it's in the middle of the front of the spine. That's the perfect place. You see the dye in the foramen on both sides? That's because there's a tear on both sides. There shouldn't be any tear. Normally the dye would stay dead center in the middle of the disc. It wouldn't leak out. But because this patient has annular tear with disc herniation, that's why it's leaking out. We're going to go in there and clean that tear. The procedure is called the Deuk laser disc repair. Now, the alternative would be a fusion, ACDF, or an artificial disc. And this patient didn't want either. He didn't want metal in his neck. He didn't want anything unnatural. We flew from Hawaii with his entire family. They're going to Disney next week. This is outpatient surgery. He's going to go home today. When I say home, I don't mean Hawaii, I mean his hotel. All right, we're going to advance this dilator tip all the way to the back, and then I'm going to slide over the dilator this tube. This tube is what I do the entire surgery through. It's 4 millimeters, which is why the incision is only 4 millimeters. There's no damage done under the skin. We're not hurting anything in his body. People ask me, well, don't you make a hole in the front of the disc? We do not. We actually push through the fibers, and the fibers spread apart. The disc is fibrous. Fibrous means it's like the clothing you're wearing, okay? Let me just see if I can advance it before well, okay, fine. All right, so think about your cotton shirt. If you were to put a pin in your shirt, like a little safety pin, it's not cutting a hole in your shirt, it's spreading your fibers, your cotton fibers apart. Shot? Now, because the dilator came backwards, I have to set it again. And I will tell you this, if you don't reset the dilator, you're just going to biopsy the disc. We don't want to biopsy his disc. A biopsy is where we go in as a surgeon and we cut a hole in something with a tube to get a piece of tissue. We don't want that. We're not trying to biopsy anything. Shot? The answer is there's pressure inside this disc. He's got a lot of inflammation. Why would there be inflammation? Because he has a tear, he has a herniation, and his body is attacking that herniation, trying to get rid of it. And that's where all his symptoms come from, is inflammation like you guys saw on the video just a few minutes ago. My goal is to get rid of that inflammation by going in the back of the disc and cleaning the back of the disc out. And that's what we're going to do right now. We do that endoscopically. Because we're not taking the disc out in the front, we're not doing a discectomy, we don't need to put anything in the disc where the disc used to be. The only reason doctors, surgeons do a discectomy is to get to the piece of herniation in the back. But we're not going to do a discectomy. We're just going to go through the disc with the tube out the backside, and we're going to treat the herniation directly without taking the disc out. The whole reason you need a fusion is because the surgeon took your disc out to get to the back. I just pushed the left arrow and I don't, oh, there it is, okay. So this surgery eliminates the need for fusion, artificial disc, because we're not removing the patient's disc to do the surgery. We're just traveling to the back. You want to put a 4x4 there?
Yes, sir.
There's a piece of herniation right there. You guys see it?
Yes, we do.
We just floated it right out. Let's show the audience how the cervical Deuk laser, there's another piece. So that's two or three pieces so far. There's another one, 4, 5. See all the pieces of herniation? There's another one that went by. Here's a bigger piece right there that is, it's going to be difficult to get out, but it's also scarred. You see the white color? That means scar tissue. But this is it right here. We're at the back of the disc, and we're just underneath all this herniation right here is the spinal cord and nerve roots. So we're literally operating on top of the spinal cord and nerve roots. This surgery you're watching has been, oh, there's another piece, peer-reviewed and published multiple times, and it's a bit bright, but that's not bad. It looks like it auto adjusted the light. Is that correct? That's good. I like that. There's another piece of herniation. How many is that so far, Henry? It's like 10?
I was going to say about 10 or 11.
Yeah. So what I was saying earlier is that we all think disc herniation is something, right? One thing, one herniation. It's not. Turns out it's around 30 pieces on average. So far, we just started a few minutes ago. We were already at 10. There's 11 pieces. So it's like a bag of herniations. And when it gets so big, your body is attacking it so hard, that's when all that pain and inflammation gets really bad. And that's why he's here. He traveled halfway around the world from Hawaii. That's how the islanders say it, Hawaii. He came here from Hawaii to get his neck fixed because all they offered him in Hawaii was fusion, artificial disc and fusion. He didn't want metal. I don't blame him. We've had a lot of patients from Hawaii over the years. I'll say it the way most Americans say it, Hawaii, because I'm not an islander. I'm not going to pretend to be. But this is the surgery Elon Musk should have had. Instead, he had metal put in his neck, and he's going to suffer because of that. But he's going to need more surgery, Elon Musk. I like Elon Musk. I hope he comes to Deuk Spine someday and gets fixed the right way with a laser surgery. Any questions from our audience?
At this moment, no current questions.
Did you show them the DLDR?
Not yet. We were just about to.
Yeah, well, just do it. You don't wait for me to tell you. You can just go into it.
Copy that.
Welcome back. You can see from our animation that Henry played for you that what the surgery does, it uses a very small skin incision. We go down to the back of your disc where the herniation actually is, and we remove just the herniation. We don't take anything else out, and because we're not removing the disc like every other surgeon does, you don't need a fusion or metal put in your neck. Now, I learned the endoscopic technique over in South Korea from the inventor, Dr. Sang-Ho Lee and Dr. Gun Choi. They taught me to do this surgery about 19 years ago. And I know that the Koreans have not done as much of this. They've moved more towards fusion, and that's because they don't use the laser like I do, so they're not aware of this procedure, the Deuk laser disc repair. And they've just gotten into doing more invasive type procedures. Why? I don't know why. Doesn't make sense to me. Any questions from our audience?
At this moment, no current questions.
All right. This is there's another herniation. A lot of scar tissue holding these herniations in. That's why you need the laser. So I think the reason the Koreans didn't have great success is because they weren't doing my technique. So I learned endoscopic, but they need to learn the laser debridement from me. And if they did, they would still be doing a lot of laser surgery rather than fusions. We are at the back of the disc. There's just a little bit of herniation left. Remember, this is C5-6. Next, we're going to go to C4-5. The other thing that I pioneered besides the use of the laser in this way at the back of the disc is the multiple disc surgery. When I learned in Korea from the originators of the endoscopic cervical surgery, they were only treating one disc at a time. Patients would have to come back if they had more than one disc problem. I figured out a way to do the surgery so the patient doesn't have to come back and get more than one surgery. You can do it all in one surgery.
We have a question
Sure.
coming from Brad on YouTube
Hello, Brad.
asking, do you...
Wait, let me guess. Something about a posterior cervical.
No, not this time. Not this time. They did ask, though, do you attend any major spine conferences?
I do attend major spine conferences, but not as much now as I used to. The problem, Brad, is that spine conferences are now controlled by the companies that sell metal to surgeons to put into people's spines. And these companies control the agenda. So everything is about, how do we do more fusion? How do we do more artificial discs? How do we put more stimulators in? It's not about progress in the field. It's not about real science. Now, when I started being a neurosurgeon 27 years ago, meetings were still, they had the commercial interests of these companies still involved because they were the sponsors of the meetings. But the scientific committee was able to control the agenda so that it was still scientific. Now it's just commercialism. It's just marketing the whole time. And they're really a waste of time going. I've gone and gone and gone, and it's always the same thing. It never changes. It's always talks that are controlled by the implant companies, the companies that make the metal screws, rods, plates. They decide who's going to give the talk. They decide what the subject of the talk is going to be, and they use a scientific committee as sort of a fake committee that, oh yeah, the scientific committee has vetted all the talks, they've reviewed all the subjects, and they approve, right? But the truth is that they're controlled by the implant companies. And there's nothing you can do about it, unfortunately. The truth is the spine meetings, and the educational groups like the American Association of Neurological Surgeons, the Congress of Neurological Surgeons, spine, all of these groups are supposed to be nonprofit and they don't have much money, but these meetings are expensive, they cost a lot of money, and they need sponsors. So to get sponsors, they have to give the sponsors what they want, all right? And they'll make $5 million, $10 million for a meeting. The American Association of Neurological Surgeons can make at least $10 million for a meeting. And in exchange, what they're giving the companies like Medtronic or Johnson & Johnson, DePuy, the ones that market heavily and advertise their products at these meetings, they give them control of basically the content of the meeting in exchange for donations that are, who knows where that money really goes. But the meetings have completely become unscientific. And frankly, I don't like to waste my time going to the meetings that are not scientific. This is all scar tissue and calcium. You see the gold color? This is an old part of the C5-C6 herniation right here. This is an old part. Remember the flaky herniations that came out earlier? This is like scar tissue right here at the back of the herniations. I just got to make sure there's no more herniation down here. I don't see any more. So I'm going to flip back and look to the patient's left foramen. and we're going to make sure we're not missing anything. But we're almost done with this disc. We've taken out about 30 plus pieces of herniation. There's another one. This is a more recent piece. See how fibrillary it is? All those like tentacles, and that means it hasn't been scarred up too much. That means it hasn't been around too long. So it's more recent. And again, the highlight here is that herniated discs are dynamic process. It's not a one-time thing. It doesn't just happen at one episode. It happens over years, and you get more and more herniation. And no one's ever said that before. We're the first to discover it. We're the first to talk about it. And, you know, I thought a herniation prior to doing these surgeries, I thought it was like a one-time event. You know, oh, I had a herniation. It happened last Saturday, you know. But no, you may have had another herniation last Saturday, but you already had 25 of them over the last 10 years. And I think people need to know that, you know. And the reason why you get so many herniations is because there's a tear in the back of your disc, and it's letting the herniations out. It's like having a tube of toothpaste and, oh, thought I saw a piece of herniation in the foramen. That's foraminal ligament. The nerve root is just underneath that. And normally I'd stop, but I thought I saw a little jiggly of a herniation out there. But it looks like there's nothing really there. So I'm going to come back. There's a piece. Piece of herniation right there. Perfect. You guys see that? So we're probably at about, I don't know, 35 pieces of herniation at this point. Questions?
Yes, we have a lot of questions. This next one coming from Jamie on YouTube.
Sure.
Jamie asked, does the herniation and inflammation have a tendency to come back after surgery?
No. Jamie, when I fixed with Deuk laser disc repair, this surgery you're watching, herniation does not come back and the inflammation does not come back. Our patients get this surgery and they do well for the rest of their life. The only way they can get the herniation back is if they re-herniate. And that does happen in this surgery. 1% of our patients re-herniate. That's the actual number. So we've done over 2,000 of these surgeries that years, and we've had 21 re-herniations. So 1% will re-herniate, 1%. And I can tell you this, it's 99% of the time it's because the patient didn't listen to what we told them to do. Look at that area of inflammation right there. You see that pink? Okay? There's nothing I can do about that, and we don't need to. That will go away because I've removed the cause. The cause was the herniated disc. The herniation's gone. So that inflammation will die off. Okay? But if I try to zap it with a laser, the spinal cord is right underneath that, and I could damage his spinal cord. I'm not going to do that. So as a surgeon, you have to know what to do and when to stop and when to go. It's decisions I'm making constantly. And the endoscope allows me enough vision to see it. And I have a lot of experience, not just with endoscopic surgery, but with ACDFs. I've done 1,000 ACDFs and artificial discs in my career, 27 years. And I've done 500 PCDFs, posterior cervical laminectomy and fusion. I don't do laminoplasty because I don't think it's a safe or effective procedure. It's, in my opinion, just not a good surgery. I wouldn't recommend it. At this point, we're done with C5-C6. We're going to move up one disc to C4-C5 because this patient needs 2 discs fixed. And that should get rid of 90% or more of his pain. Next question.
Next question coming from Eric on YouTube.
Hey, before we take the question, take a look right here.
One moment.
Lateral, please. Move your arm. Can you see right here?
Yes, we can.
That's a whole pile of herniated disc fragments. Look at that thing. Where's the ruler? Okay, that's about 20 pieces of herniation. They all just kind of came out of the tube and just sat there. You see that?
Yes, we do.
So that's a good picture for the website if you want.
Yeah. I'll let Sanjay know.
All right. Shot? Huh? Let's see. I might be okay. We're moving up. I need you, Jordan. Is that where we are? Let's get a good picture. Luis, I need your help. No. Before I take another question, I want to make this move. Shot? Can you hold the head, please? Inline traction. All right. Shot. There's too much light in my eyes, guys. I don't know why we have all these lights on. Shot. I need to be able to see this screen. Okay, coming out of this disc. So far we've lost 1 drop of blood. 1 drop. Oh, that's good, Jordan. All right, here we go. Shot. I'm almost out, and I'm going to move up 1 disc. I just need to have full attention right now, so I'm sorry I won't take any questions for a few minutes, but I want to make sure we do this right. Shot. All right, so I'm out, I'm halfway up, and I need to make sure I'm in the middle. I don't want to be off to the left, off to the right. I want to be dead center, or at least a centimeter left, right of center. All right, so I'm too far to the left. I have to come back to the, let's stay there. Shot. All right, perfect. I'm in the middle. Let's go back to a lateral. I'm using the X-ray machine to guide and to localize. We call that localization and navigation. The part of moving things around in the patient is navigation. Shot. It's like navigating a boat or a plane. Shot. All right, so I'm really happy on the lateral view. Let's see if we're still in the middle. I may have to make a left to right correction. Let's just see. 2, 3, 4, 5. All right, we're still in pretty much in the middle. I can move a little bit to the middle, a little to his right. Shot. That's perfect. Now let's get a lateral, and that's perfect. So just hang in there, everybody, for another minute. I know we make this surgery look easy, folks. It's not an easy surgery. Don't try this at home. Don't try this in your garage. Shot. Don't be a Bill Gates. This facility is now it's a $20 million facility. Shot. And you need pretty much everything we have to be able to do this kind of surgery. Shot. Shot. All right, we got some out. Look at that. So what this tells me, based on what I'm seeing there on the X-ray, is the dye has leaked out through a very small, difficult to see tear, and I can feel resistance in the disc to this dilator. Shot. And I can tell you right now, the reason I'm feeling it, shot, and the reason we're not seeing a bigger tear is there's a lot of scar tissue here. It is not normal, which tells me this disc is probably the one that's been injured the longest. 4-5. Shot. Now, when I look at the end plates of 5-6, the end plates of 5-6 show bone spurs in the front, and I would think 5-6 was injured the longest, but there's a lot of scar tissue in this disc. I can already tell, just by the feel. Shot. Any questions?
Yes, this next question coming from Eric on YouTube.
Hello, Eric. Welcome to our live stream.
Asking, are these procedures beneficial for herniation and not loss of disc height?
So I'm not sure what you're trying to get at, Eric, but these procedures are all you need. There is no other procedure you need. Loss of disc height is not important. It doesn't cause symptoms, ever. But surgeons like to tell you, oh, you have loss of disc height. We have to put a cage in there or a piece of bone. But that's not true, okay? In the end, people don't have surgery because they have loss of disc height. And if you're being told you need something done to restore the disc height, I don't know any surgeon in the world that would do spine surgery to restore disc height. I know surgeons who do surgery to get rid of patients' symptoms, shot, or abnormalities on exam like weakness, numbness, tingling. But I don't know any surgeon that would recommend surgery for loss of disc height. So no surgery needs to be done for loss of disc height, and there is no surgery that will restore all of your disc height. Is that it? Right there? Oh.
Yeah.
Hold on. I want to go in a little more. It's pushed me back. I think all the scar tissue has literally pushed me back. Just gently. Okay. Let me see. Shot. See, it keeps moving. Shot. All right. Let's hope it stays there. That's pretty good right there. I like that. Let's see. Try to keep it there. And shot. All right, that's good. So there is no surgery done for loss of disc height, no treatment for loss of disc height. Nobody needs any treatment for loss of disc height. And I know there's a lot of doctors out there talking about loss of disc height, the people talking about loss of disc height, but it's completely fabricated nonsense. It's like the Loch Ness Monster. Don't have surgery for loss of disc height. Have surgery because you're having pain, or because you have neck pain, headaches, arm symptoms, pain down your arm, weakness in your arm. That's why you have surgery. And this surgery fixes all of those without doing anything with loss of disc height. Yeah. And there is no additional loss of disc height with the surgery because we're not operating on the disc. We're operating on the herniation. Great question. Thank you for asking. All right, a lot of inflammatory tissue. You see that red stuff, the pinky stuff? That's inflammation. This disc, if I had to guess, is the one causing most of his symptoms. 4-5. There's a piece of herniation. Come on out. We don't want you anymore. And that's a lot of inflammation right there. You guys see it?
Yes, we do.
A lot of calcium. You see that? That means it's been going on for a long time. Scar tissue. Look at all the white stuff. Scar tissue. Lots and lots of it. Just as I predicted. More. All right, we're going to be done in 5 minutes. Dr. B. Yeah, I do like the fact the scope auto adjusts the light. We'll take the next question.
Next question coming from, coincidentally, a different Eric on YouTube.
Is that really their name, a different Eric?
No. The first Eric was Eric Fitzgerald. This one is Eric Booker.
I know, I'm just joking.
And they ask, will cigarette or cannabis smokers have any issues after the DLDR?
The answer is no. Cigarette smoker, or what was the other one? Cannabis?
Correct.
Yeah, we have lots of cigarette smokers. We have lots of cannabis smokers. We don't judge. But the only thing that you have to think about with cigarettes and cannabis is the anesthesia, okay? And if you're a cigarette smoker or cannabis smoker, we want you, in the ideal perfect situation, to stop your use of cigarettes and cannabis for 2 weeks before your surgery. Now that said, we have lots of patients who don't stop, and they do fine. But as far as after the surgery, no, there's no problems at all. During the surgery is what we worry about, the anesthesia.
This next question is coming from Brad.
Well, let me just make sure. Dr. B, am I right about that?
Yeah, I would agree with that. The cannabis can affect the medications we use to sedate, start the anesthetic,
Yeah.
maintain the anesthetic.
Yep. Yeah, Dr. Berndes is saying cannabis just has an effect on the medicines we give you during the surgery. But it's the same thing I said, which is when you're done with the surgery, there's no problem. It doesn't have any effect on healing, recovery, really. But it's just during the surgery that it can make it a bit more challenging to do your surgery. That said, we have tons of patients who take it and smoke, and they're fine.
We rarely had that problem before it was legalized. Now that it's
Right.
legalized, the THC concentrations are so much higher.
Dr. Berndes is just saying that before the legalization of cannabis. These are all pieces of herniation, by the way. And my foot is getting wet. Fucking hell. Before the legalization of cannabis, this is coming out nicely. Look at that. Boom. Come on. Get out of here. All right, we're going to say it together. Get out of here, you bum. To the next piece of herniation that we float out. Okay, you guys say it with me. Get out of here, you bum. Man, my foot is totally wet. All right, here we go. Let's do it to this one. Well, that's not a good one, but we'll get it out. Get out of here, you bum. So we're removing the herniations from the back of his disc at C4-5. I appreciate the blanket on my foot, but I think it's the water that's the problem. There's the tear right there. You guys see it? I just zapped it.
Yes, we do.
It was tiny, really small tear. Right there, you can see some more of it. That's where the herniations are escaping. That's where the nucleus is escaping. What's really cool, folks, you guys are watching history in spine surgery, truly watching history. Every surgeon in the world will be doing this surgery in the future because I truly believe the patients are going to demand the best. And the surgeons, that they're going to want to do this because it's the best surgery for patients. It's the best results, you get the highest amount of pain relief. There's no need for metal or implants. It's the cheapest surgery you can do. And recovery is 1 hour. 1 hour recovery. This is the future. You guys are watching it today at Deuk Spine. We're the pioneers. I pioneered this technology. There's the tear right there. You guys see it? Man, I'm feeling dripping all over my foot. You need something on this hand. Okay? Give me a Raytech on this hand.
Should be fine, Sam?
No, there's nothing wrong with the suction. It's the water is dripping from my wrist to my foot. Past the bag. All right. So I'll be happy to take a few more questions. I need 4 more minutes.
This next question coming from Brad, once more on YouTube,
Hi, Brad.
asking, what are your thoughts on discograms?
I don't know what you're asking, Brad. We do discograms. I know you know that. Are you asking about discograms before surgery, like as a diagnostic test? And if that's the question, I'm a big believer in discograms, but I don't do them before surgery. To do it, now I know when a disc is causing pain because I've done so much surgery on discs and I've seen the results. I can tell when a disc is the cause of the pain based on my evaluation. We have a name for that evaluation. It's called the Deuk Spine Exam. And the Deuk Spine Exam is how we diagnose the source of your pain at Deuk Spine. It's something that we are going to be patenting, and it's something that I developed over time. And basically it gives us the accurate diagnosis about 98% of the time. The only times it's wrong is when we leave out some stuff because the patient didn't have pain on that day from the other areas that were causing pain. So what I'm saying to you is we now can diagnose the source of pain without a discogram. We don't need it. This is all thick scar tissue as I predicted, and that's why the tear on the discogram I just did was so small, because there's such thick scar tissue that the scar tissue doesn't absorb the dye, it just channels it. All right, it's like a rock, a granite rock, and channeling a river between it. Now, if there wasn't as much scar tissue in the back here, then the dye would diffuse into the tear more unevenly, and you would see the tear better. But with the granite face of the cliffs channeling the dye out the foramen and the epidural space, you don't see much, and that's why. So this disc has got a lot. Look at all this calcium. This has been a problem for a while. I'm out in the left foramen at C4-5. The nerve is literally right down there, just past that piece of ligament. We're not going to mess with the nerve. Questions?
No current questions, but we do have a couple of comments. This next one coming from W.I. Patriot on YouTube.
I love Patriots.
Saying, I'll be catching Dr. Deuk on here on YouTube now. Facebook disabled my 4th profile. They hate the truth. But I really find watching these surgeries very informative. I need surgery at C4-5 and C6-7. I canceled my fusion and waiting to get care from Dr. Deuk.
Oh, you made the right choice, my friend. You made the right choice. You made the right choice. I would not do fusion if you can avoid it. I know some people can't do the surgery. Their insurance may not cover it and they can't afford it. So I feel bad for those people. We're trying to change that. I've talked about this for a while now, but I just signed the contract with the attorneys in New York who are going to take on the insurance companies that don't want to pay for the surgery for patients. And guess what? They don't get paid unless they win. And lawyers don't like to work for free. So they expect to win. We have all the evidence and proof to win. We just have to have some luck on our side and patients that are willing to go up against their insurance to get them to pay. So I'm excited about the future. We've cracked the code, so to speak. We figured out how to cure neck pain. We just got to get the insurance companies to pay for it. And they don't want to. They don't all want to because they know. I have the pedal, right? Yeah. They know. I'm trying to find the pedal with this towel here. The insurance companies know once you guys find out about this, you're all going to want it. And you should get it. And after all, that's what insurance companies are there for. They're supposed to be there to pay for your medical care that's necessary. And this is necessary. This is absolutely necessary care. These people can't live in pain. And I'm going to say this. I know it sounds terrible, but we've saved a lot of people from suicide. And we've saved a lot of people from, self-harm. If you think about it, people with chronic pain, they're limited in what they can do in terms of treating their pain. A lot of them drink alcohol excessively. A lot of them do drugs to get out of pain. And I'm not saying, I'm just saying that people should have a choice about getting out of pain. They should be able to get out of pain. They shouldn't have to live in pain. They shouldn't have to contemplate suicide or self-harm with drugs and alcohol to the point that they're treating their pain. It's important to me. That's my mission in life, is to basically give people the access to this type of treatment so that they don't have to live in pain anymore. And they don't have to suffer. We just gotta fight. You gotta rise up and fight. Fight for what's right. All right, next question.
No current questions, so we do have another comment coming from Michael on YouTube.
1 minute, yeah.
Saying, this is really fascinating. Would love to come see you all down at Deuk Spine Institute. Really enjoy seeing these procedures so clearly with your added commentary and expertise.
Oh, you're welcome. You're welcome, Michael. That's why we're here. We want people to know it exists. We want people to know they have a choice. We want people to know they can get out of pain and don't have to live in pain the rest of your life. This patient came all the way from Hawaii just to have this surgery. This one and the one on his back. And we're just about done. He's gonna go back today to his hotel and he's not gonna have this pain anymore. Man, we've taken out like 30 pieces of herniation from this disc too. You guys see all that? Look at all these things.
Yes, we do.
Every one of these is a herniation, every single one. But so you guys see it, a herniation is not one piece. Some of them are like 5 years old, some are 10 years old, some are probably 6 months old, but all of it together is what causes the symptoms to get worse over time. I'm just about done. I'm going to take the rest of the questions. Oh, look at all those pieces. Oh, look at all those pieces. I just hit I don't know what you call it, a cache, right? It's like when you're digging for gold and you suddenly find like all this gold. Huh? You guys saw all those pieces come out of that hole, right? That hole is in the back of his disc. That is the tear. I mean, that's the really deep tear. And those are sitting on top of his spinal cord. So I got to go clean it up. That's scar tissue right here from all the inflammation, all the years of inflammation. There's calcium. Calcium takes years to lay down like that, okay? It's like you hear about a diamond, right? Diamonds take like, what, 1,000,000 years to be made, or 100,000 years, whatever it is. It doesn't happen overnight. All this stuff, scar tissue, calcium, takes years. This problem's been going on for many years for this patient. There's another piece right there. Oh yeah, come on out. Get out of there. Yeah, there we go. Just about done, folks. And I'm just going to clean this a little more so it heals properly. One of the things the Deuk laser disc repair does, no other surgery in the world does, we let these holes heal. See, this hole could not heal. His body could not heal this. That's why there's a hole here. It's evidence he couldn't heal it. So what I do is I go in, I clean it up with the laser, get rid of the herniation pieces, and now his body will literally seal that hole off. But it'll take 9 months. You guys notice how the tissue's all white? It's white because there's no blood supply. There's no arteries, veins, capillaries here. This annulus is avascular. It has no blood supply, which means it takes a long ass time to heal, and it heals through diffusion. Diffusion is the movement of things across concentration gradients, right? Oh man, there's still a piece of herniation right there. I need literally 1 minute, Dr. B. I'm almost done. Look at that piece of herniation buried underneath the posterior longitudinal ligament. That's a big one. Got to get it. But amazing, huh? The ability to see this stuff with the scope. Oh yeah, I can feel them. Remember, underneath this is his spinal cord, so I could feel his body moving, because not because the laser's hitting the spinal cord, but because there's a pulse wave, and because he's not chemically paralyzed anymore. All right. Yeah, I know you did. That's why I'm feeling his muscles twitch. It's pretty amazing, isn't it? This is the only facility in the world that does this surgery, folks. And there is the spinal cord right there. You guys see the red? That's the spinal cord right there. And that herniation was literally sitting on top. I've gotten rid of 70% of it, and we never go for 100, because if you try to get 100, you're just going to end up screwing up and hurting the patient. So I feel like I've gotten all that I can get out safely at this point. I'm very happy with our surgery.
Sitting on, please. Thank you.
That's another lesson for you all. No surgeon can get 100% of a herniation. I tell all my patients, 50% is what we shoot for. I mean, I shoot for 100, but you need about 50% to get rid of symptoms. I'm going to come and answer all your questions face to face, because I'm just so happy for this patient. Like I said, he's here with his wife and kids. I met his daughter. Can't give you their names, but we don't want to give away his identity. But type your questions up. I'll come answer them for you, but I'm very happy with the results. And like I said, number 4-5, the second disc, was the worst one. You're going to see, folks, this is a 4 millimeter incision, 4 millimeter. We did 2 discs, 4 millimeters, took us an hour. This patient's going to go home in 1 hour. There's no hospitalization. There's no fusion. Any other surgeon would have done a fusion on this patient, ACDF or artificial disc. And there it is. You guys see this?
Yes, we do.
Perfection. 4 millimeters. The whole surgery, 4 millimeters. Great job, team. Thank you so much. Scope use is a 6. All right, Henry. Take us to commercial.
Yes, sir.
Dr. Deuk Machen, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube. And what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company?
They pay because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics?
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
And I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Deuk and his group because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday, today's Wednesday, and we're going to stay till Sunday, enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them. All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. Wow. Love those patient results that are so good. You know, when you make the right diagnosis as a doctor and you provide the right treatment, patients do so well. And the Deuk laser disc repair you just watched for 2 herniated discs in the neck, it's the perfect treatment. No bleeding. You know how much blood we lost? We lost 2 drops of blood the whole surgery. We're not cutting you open. There's no big incision. There's no hoarseness, no difficulty swallowing, just a little bit of from the tube being down. But you know, when you have an ACDF fusion, artificial disc, those surgeries are extremely invasive. The surgeon has to cut your neck, dig around in the muscle, cut the muscles, It cut the strap muscles and move the trachea and esophagus over, separate it from the carotid sheath and its contents, and the sternocleidomastoid muscle. So there's a lot of trauma happening with open neck surgeries. None of that happens with this surgery. That's why there's no bleeding, there's no pain. These patients, the one you just watched, no narcotics, no painkillers after surgery, just a muscle relaxer, which most 50% of the patients don't even take their muscle relaxer, Robaxin. So it's essentially, pain-free surgery, and you don't have all the complications that happen with hospitals. It's an incredible surgery. No metal, no fusion, no plates, no screws, no cages, and the results are second to none. So I know we have some questions, and if you have any, type them up because I will answer them for you. Our next patient is going to be a lumbar Deuk laser disc repair. Now this guy had a fusion done elsewhere, and I didn't do it, but he came here because when you get a fusion, your surgeon recommends a fusion. What he's saying to you, and you got to understand the language here, is I'm going to go in and do a fusion, and you're going to have to come back for the rest of your life and get shots, take pain pills, get more fusion, more surgery, more laminectomy, spinal cord stimulator. They're committing you to a lifetime of suffering and dangerous treatments, and they're not telling you about it, okay? But it's true. This patient had a fusion, and now he has adjacent segment disease above at L23, and he's got pinched nerves from that herniated disc at L23 and spinal stenosis. The herniation went backwards. It's pinching the nerves behind the disc. I have to go in with the laser, clean out both sides, and we're going to do L5S1 below his fusion, which is also causing pain. Then we're going to do his SI joint, maybe?
I think so. Hold on.
I gotta go back and look and see.
SI joint and then DPLR.
Facet.
Yes.
So we're gonna do that as two surgeries, like one surgery but two streams. So we'll start with the laser surgery, 3 discs.
I think he has not to be.
Oh, he's not. He doesn't
Yeah.
want to be broadcasted.
Yeah, this patient. Yeah.
Oh, never mind.
Yeah, I apologize.
He does not
Yeah.
want to be broadcast. Sorry about that, folks. I lied to you.
Yeah.
The next patient does not want broadcasting. We're not going to be able to broadcast. So, anyway, I guess the next one you'll see will be in a couple of hours, and it will be lumbar.
Lumbar, right? One level with a right.
One
performance.
level lumbar Deuk laser disc repair for a herniated disc,
Yes.
causing pain. All right, let's take the question.
All right. This next question coming from Tracy on Facebook,
Hello, Tracy on Facebook.
asking, have you ever contemplated doing DPRs on peripheral nerves, i.e., superior cluneal nerve?
Yes, yes, Tracy. We do DPRs on all kinds of things now because they work. It works, and so we've done thumb, we've done toe, we've done ankle, we've done wrist, and we've gotten rid of the pain permanently. It's amazing. Deuk plasma rhizotomy. It deadens the pain nerves to a joint that's painful. Superior cluneal nerves or cluneal nerves, we would do. I don't think we've done the cluneal nerves, but we do it. Absolutely. Safe. It's safe procedure. And if it works, man, that'd be awesome.
Yeah.
So get in touch with us. Let's do an MRI review and let me make the diagnosis, and then you come here and get it done. Any other questions?
Yes, we have 2 questions, they're both coming from AAKK on YouTube.
AAKK.
Asking,
By the way, this patient we're doing right now brought me some goodies from Hawaii for me and my staff, and I've shared them. One of them is a big bag of Hawaiian coffee, ground up, vanilla flavored, macadamia nut, amazing. We had that yesterday and the day before. And he also brought some chocolate chip cookies, which I didn't eat because I have diabetes. But the rest of the staff, I mean, that bag was gone in like 60 seconds. Seriously, I put that bag out for the staff to eat. It was literally, it's gone.
It's gone.
I
Yeah,
mean,
no,
it was gone within like an hour.
Yeah,
seriously.
I couldn't even get some. I was just like, oh, but it's open.
Really?
Yeah, yeah.
I'm sorry to hear that.
Nah, it's no on that.
But we appreciate gifts from our patients. I love my gifts from my patients. I had a Hawaiian patient about a month ago that gave me the little nuts, a necklace of those nuts. I forgot what they're called, but yeah, I got a lei from them, and she was so happy with her surgery results. She waited till after surgery to make sure she was doing good. She gave it to me.
Yeah.
Actually, I wore the lei.
Did you?
Yeah, I wore it for the video, for the testimonial. She gave. So if you go back and look at some of our testimonials on the lumbar Deuk laser disc repair, you can see me wearing a Hawaiian lei.
Yeah.
I don't know if it's out yet. Maybe it isn't out yet. I don't know.
I have a lot in store, but yeah.
I know you do.
Yeah, yeah.
You've been working on the website. Thank you. All right.
Yes.
What's the other question?
This next question coming from AAKK said, "Hi, Dr. Deuk. As you laser the tear, I do see components of herniation coming out.
Yep.
In your opinion, are there ever pieces of healthy disc nucleus that float from inside of the disc to the tear area?"
Great question, AKK. There are no healthy disc pieces that come out because the disc, the healthy nucleus, is not in pieces. It is a solid structure that is not fragmented in pieces. So when you see fragments, herniations, that is damaged nucleus. The other clue is that a lot of times the damaged nucleus will stain blue, whereas healthy disc is not blue. So some of those pieces are a whitish color because they're scarred up. Other ones didn't get the dye because they didn't come out very much. But no, the normal disc nucleus is solid. It's not in pieces. So anytime you see chunks, it's always fragmented nucleus.
And then their follow-up question from AAKK asking, "And are those truly pieces of herniation, quote, degenerated nucleus? If so, how do you know when you are done removing fragments and the surgery is complete? This is excellent news. Thank you, Dr. Deuk." That makes sense. That was his follow-up comment.
Great question. So number one, the way I know I'm done is because I literally take that tube and I sweep it from all across the back of the disc where the herniations were. And I can see there's no more herniations. I also pull it back a little bit, which is pulling it in to the inside of the tear, and I sweep it, which you probably saw me do if you go back and watch. And that's how I know I got it all.
And then we just got another question from Baba Yaga.
Baba Yaga.
I love that.
I think we've had Baba Yaga before.
I think
yeah,
so.
yeah, we have.
And then they asked, "Doc, what do you think about discogenic stem cells? How far are we from biodisc or stem cell treatment?"
So Baba Yaga?
Baba Yaga, yep.
Baba Yaga. Is that like
That's-
is that Russian or is that Israeli?
I think it's Russian. It's from the John Wick movies.
Oh, yeah.
That's what they call him, Baba Yaga.
Yeah, so look, I'm going to tell you this honestly. We could put stem cells in the disc today. I could do it. I did it about 8 years ago. We did it just to see if it would help. All that did was create more inflammation and more pain for the patient. It literally caused pain in that woman's back that I did it. And she asked me to do it, by the way. I didn't just do it. It caused pain in her back for months after the surgery. I had never seen that before, so much pain. But she was miserable. And in the end, it didn't do anything. The pain went away after 2 months, 3 months, but the stem cells didn't do anything. Stem cells are a lot of hype. No, listen, I'm a biologist, I'm a biochemist, I'm a cell biologist. That's what I did my training in at UC San Diego. I know all about cells and their function, and stem cells are very important, right? You need them for regeneration of tissues. But putting them in the middle of the disc in an adult is just not a good idea. And the reason it isn't a good idea is, number one, they're always going to come out. Number two, they're always going to cause a lot of inflammation. And number three, they're always going to die. So if they don't come out and die, they're going to die inside the nucleus because there's no blood supply. Cells cannot live without blood supply. So those stem cells are just going to die. And but listen, there will be venture capitalists that buy labs that develop stem cells for these applications They will sell it to you guys. They'll market it on TV. Stem cells to repair your disc. It's all bullshit. Okay, I'm going to call it as it is. I don't believe it's right. I was brought up in a different era, the 80s, by good parents with Christian background. Okay, nothing against other religions. I embrace all religions. Okay, I embrace them all. But what I'm saying is I was brought up with principles and values. And one thing that I truly believe to my core, and I was taught this at a young age, don't lie to people, always be honest, tell them the truth. There's nothing wrong with the truth. The truth may not be what you want to hear. Truth may be inconvenient. It's going to hurt some people's business. But the truth is the truth. And I'm a scientist. Science is all about truth, all right? And not everybody acts like a scientist that is a scientist. But the truth is, I like the truth. And if you know the truth and you work within the facts, you can find answers to problems as long as you're based on the truth. Stem cells to regenerate the disc is a myth. It's 2024. Maybe I'll be wrong, maybe 30 years from now. But if you go back and watch my videos, the most important thing I say about the nucleus pulposus is that it used to be the notochord when you were a developing fetus, and your body imprisoned that notochord remnant, nucleus pulposus, in the middle of the disc for a reason. That it can't get rid of it. It doesn't spit it out of the fetus. It keeps it, but it incorporates into the middle of the disc as a cushion. And everybody thinks that nucleus is so important. Oh, I got to have the nucleus. Got to have the nucleus. That's what I thought. I was brought up to believe that. The truth is, you don't want the nucleus, and the reason your body imprisons it inside a disc that doesn't have any blood supply on the inner membrane, inner wall, is because it's highly inflammatory material. And that's why it causes so much back pain, neck pain, arm pain, leg pain when it herniates out through the tear. So, in a perfect world, you wouldn't have any nucleus. Nucleus is just a problem in an adult. Okay? So, will they have stem cells to regenerate the nucleus? Absolutely. Should you get it done? Absolutely not. Is it just a big marketing scam to make millions or billions of dollars off the public? Yes, it is. Would I ever do it for me? Absolutely not. Okay?
That is it for questions.
All right. Great surgery. Hopefully our patient has a speedy recovery. He will be discharged in about an hour to his family. They're going to go to the hotel, and I think they're hitting Disney. In Orlando, Florida, is you can go to Disney World or Universal or NASA. There's so many places. SeaWorld. Thanks for joining.